Yeah.
Hey,
Sir.
morning. Morning. I used to say it's like a smoke.
One of those types.
What black?
Judge Hallmark? You wanna come up, Judge?
I'm not sure if Judge Hallmark is gonna make it. Ed is here, I know from the.
Last I knew, she wasn't gonna be able to make it. She apologizes, but
So we're
Sure. Happy to come up, support.
You wanna come up?
Sure.
And Steve, if please. Dana?
They're going to look for it.
Dana?
No.
We're just looking for a missing judge. Yeah. So we've got Judge Mattis, he's our chief judge for our circuit court, and we've got Ann Erickson Galt, she's county commissioner from the Troy, Madison, Team of Officers. And then of course we have Steve Norris, he's from Steve Norris is from the Alliance, I'll give the whole title, of Coalitions of Healthy Community. And then we have Dana from the Oakland Community Health Network.
Should be here in a moment.
That is still being, and then ultimately, the other one we're looking for is Judge Hallmark, so, yeah. So, how was your day? This one, just wait a second. Okay, so apparently the judge may be doing judgy things, so it's funny people yell at me when I'm judging, that's okay, judges can be judgy. So I guess we'll get started to keep you all in tonight. So we're obviously here to announce the collectively, mostly the people that are paying for it. We love to be partners with people that bring resources to the table because it's challenging for us sometimes to do things, and without partners like the Alliance and without the Health Network, we simply couldn't do everything that we do. A lot of what we're focused on, obviously, is a national crisis, and that's the opioid epidemic. I believe the number from last year was 108,000 died from overdose. And so it's gonna take a whole of society, all of government effort. We can't arrest our way out of this crisis. It has to be education, prevention, treatment, mitigation, availability to resources that help save lives so that they get a second chance. You know, I'm super proud of our crisis response team that does a lot of heavy lifting in that space. And you know, we were the first agency to deploy Narcan across our whole agency in the state. Actually, I had to go to the legislature. It took me almost 2 years to get authority from police in emergency situations to use Narcan. So that tells you how far we've come. It took us years to get that authority just in public safety, and now it's available for free to people in the community because it's that big of a problem, that big of an epidemic, and that big of a life saving. This has already saved reported 137 lives through this program alone, and obviously all of our deputies have saved, you know, hundreds and hundreds of lives using opioid interrupters. And so this is an exciting kind of furthering of that program. We've had a vending machine that's free in our jail, so on people that have gone through our programs, we have medically assisted treatment in the correctional setting, that they have this to take in case there is a moment in time when someone is overdosing, and gives them a second chance. You know, a lot of people falsely say, well, if you have these things, it encourages drug use because they know that they can be saved. That's completely false and belies the fact of what addiction truly is. All they're focused on when they have an addiction is how they get that relief, that kind of satisfaction briefly that they seek from whatever drug they're using. It could be pain, it could be a mental health challenge, whatever it is. They're not thinking about, I'm gonna die. They're not thinking about, well, at least I have a parachute in case I need it. No, that's not what they're thinking about. So it's a false analogy by some that say that this allows more people to use, and the anticipation of having that, you know, encourages them to use things that could kill them. That's false. You know, you see people that have an addiction stealing from their loved ones, their spouses, their family. They just don't have control over it. And hopefully if we save their life with this, they get a second chance to have that life, to have family, friends, you know, be around them and have a different path in their life. So this is, and I don't wanna steal any of y'all's thunder what you're gonna say, but again, it's a deepening of the partnership, and this is the 100th of these that have been deployed by these great partners within a year's time. I mean, that's a pretty amazing feat. 100 of these across Oakland County, including at the Board of Commissioners auditorium, including at the judge. Obviously, we've already had one at the jail, and now they'll be at all of my substations, including headquarters. So that gives people more opportunities 24/7 to have access to this, to be able to pick it up, have peace of mind if they've got a loved one that's battling addiction, so that if that terrible moment happens, they can be the first responder. Immediately call 911 first, then deploy it would be my suggestion, and then we can go from there. That way help's on the way, and then you immediately do your job. But this also dovetails on the other programs that we've had in the past. Operation Medicine Cabinet, one of the biggest connections and problems that you see to opioids is through the home. Medicine cabinets, when you have end of life, there's often a tremendous amount of very powerful narcotics in the home, morphine and other kinds of things. Get those out of the home so that there's not a chance of accidental use, intentional experiment with kids, or diversion out into the street for sale. Don't flush them, because that pollutes our streams and waterways. And Operation Medicine Cabinet, which actually has received national awards, is all across this county already, like 40 locations where you can drop off the drugs, no questions asked, that will be environmentally soundly destroyed. So we keep layering program on program with partners, and I think it's making a difference. We know that it's saving lives. This program, as I said, it's already 137 saves with this. We know that the police agencies across this county and the fire agencies are saving hundreds of more lives. And those are all opportunities. Those are all loved ones that get a second chance. So, who wants to speak? Do you want to speak? Steve?
So good morning, everybody. I think I would love to just mention the fact that the reason why these applications are different than traditional ways of receiving reversal medications is the reduction in barriers to access those things. And it wouldn't seem like it would make much sense to partner with law enforcement with the shame and stigma that still surrounds addiction. However, what we know, because of the amazing opportunity that we've been afforded to work directly with the Sheriff's Department and also the Crisis Response Unit, is that that measure is necessary in order to reduce stigma from both sides, from law enforcement, people struggling with SUD or substance use disorder in our community, because those are the people that truly have the hearts to really attend to these issues. So with that being said, A lot of counties have embraced traditional naloxone machines and vending machines that are very expensive. These were a very inexpensive solution to a very big problem, and this is but just the beginning. And that beginning is that this is the tail end of what we refer to as an OEND program, which is overdose education and naloxone distribution. And as Sheriff Bouchard just shared, we've done a great job with partners' help getting 100 stations into the community, but that's just the beginning. The real hard part is the education now, why they exist and what they're there for. So the connection to services, the connections to law enforcement's crisis units, the connections to all the beautiful and wonderful services that Oakland Community Health Network provides. That is really where we're addressing the issues instead of putting a Band-Aid on the problem. So I wanted to just share that. And also, the celebration today is the amazing collaboration in this county between stakeholders coming together and getting out of a siloed approach to attack a problem. We can individually make a difference, but we can make a major impact when we come together, communicate, challenge each other, get through causes for concern to really address the problem at the root level. And I think that we've done a tremendous job this year of building those bridges. The collaboration that has been inspired from those conversations has been difficult at times, but productive and successful, moving towards a future that hopefully mitigates loss and fatalities, especially here in Oakland County. So on behalf of the Alliance, my team, and all the members that went to extraordinary efforts to make this happen within a short period, under 12 months, we thank all of the partners, and we're really grateful and humbled to have the opportunity to share this moment with the county and those partners.
On behalf of the Circuit Court, we are happy and proud to partner in this important program with some great partners, and we do hope that it makes a positive impact in our community, and we expect that it will.
Good morning and thank you. I'm glad Steve said it. This is a celebration. This is so exciting. The work we do at Oakland Community Health Network and the work we've done for the last 10 years now plus really is about collaboration and coming together. So I do want to take this opportunity to personally thank Sheriff Bouchard and his team, as well as the Alliance and their teams, because we could not do this alone. And I think that's the critical takeaway here today, is that we fund the devices, we fund the resources, but we also want to make sure that we're connecting people to services. And that's our role, is to make sure that we're not judging when we have to use these tools and resources. We're happy that we have these tools and resources available to help the community. It starts with education, but it really ends with getting people connected to the services and supports that they need. And so this is an amazing collaboration that really continues to grow. I think we can talk about a number of different programs, but I'm happy we're here today to celebrate the 100th box, where we're talking about if we save just one life, it's worth every single action to get it where it needs to be. So thank you again for allowing us to speak and be a part of this celebration to get our boxes out there.
Thank you, Sheriff Bouchard. I'm Ann Erickson-Galt. I'm the Oakland County Commissioner for District 3, which, as the Sheriff mentioned, is Hazel Park, Madison Heights, and parts of Troy. I also serve on the Public Health and Safety Commission, where we're doing everything that we can to keep Oakland County safe. Public safety is a high priority for me, and although I can't speak for all the commissioners, I think I can safely say that it's a priority for all of us. When I was thinking about this earlier, I was thinking about a song that came out several years ago called How to Save a Life. I'm sorry, I'm gonna get a little emotional about this. The artist was despairing because he couldn't help his friend who was suffering from an addiction. And opioid addiction and overdoses, as was mentioned, touch all levels of our society. The sheriff mentioned how many people die nationwide or in the state. We have at least 250 people dying from this every year in Oakland County. We know that overdose deaths can be prevented. And these Save a Life stations, thank you so much to the Alliance, to OCHN, to the Sheriff's Department, to the circuit court and all of the partners that are working together to make sure that these stations, and I'm grateful to be here to partner with them as well. The notion that this is the 100th box is just, and more to come in just a year. 137 reported reversals. I think that's key. We don't know how many lives were saved that weren't reported. It could be hundreds, it could be thousands. So we in fact do know how to save a life. And these stations, which provide not only life-saving Narcan, fentanyl test strips, they also provide resources so that people that are struggling with addiction, people that are struggling with overuse or abuse of opioids can find the resources. And we at the commission are committed to investing in these stations so that we can continue to save lives and give people a better future. Thank you.
Sure. I always forget to say something before. So really quickly, the other thing we wanted to do was when there is a life saved in our community because of that relationship we have with the sheriff, what we have the opportunity to do is to actually thank our law enforcement partners individually when those rescue attempts are made. But what we haven't done is recognize the vast and tremendous work that's been done over a decade. And so on behalf of the Alliance of Coalitions and Oakland Community Health Network, we'd like to present Sheriff Bouchard this Save a Life coin. And this is representative of all the lives that have been saved in this partnership. And so thank you, Sheriff Bouchard, for all you've done and all you're going to do in the future. Appreciate you. Thank you.
I recognize that logo.
Kind of similar, isn't it?
And there's another program that many of you may or may not be aware of, and that is we have a program where if you come into one of our substations and you're struggling with addiction and say, I need help and I'm ready and willing to go to treatment, we'll take you to a treatment facility. A lot of other police departments have similar programs with a different name, but the bottom line is that law enforcement wants to help people get the treatment that they want and need. And so it's not a situation where if you show up to the police department, they're gonna go, oh my gosh, we don't wanna talk to you. It's gonna, how can we help? How can we get you the treatment and the next step that you need and deserve? Because again, it's an equal opportunity destroyer, and it comes in a variety of mechanisms where people find themselves addicted. It can be it can be some kind of surgery. It can be self-medication for a mental health challenge. But the common line is once any traditional script runs out, they go to the street and try to find a similar alternative, and what they don't know is what's in what they're buying. A kid could think they're buying an Adderall to help them focus to study, and it's been in a counterfeit pill press and it's got fentanyl, and one pill can kill. So there's no idea what you're buying on the street. So, you know, if you're struggling or if you're using legally any kind of drug, make sure you're buying it from an appropriate venue, a pharmacist that has a script and is looking out for your well-being and drug interaction. If you're a marijuana user, go to a licensed, regulated, inspected facility, because we're now even finding fentanyl in street marijuana. So you don't know what you're getting. It's Russian roulette out there. So just kind of very much be cautious about ever buying something on the street. You have no idea what's in it. Questions?
Yeah, what is the process in place to maintain and stock these and make sure that like some of these medicines are not like expired?
Sure. Do you want me to
Step up to the mic, please.
As loud as you can.
So our team goes to each station individually and refills every location on a weekly basis. The expiration date for nasal naloxone in our community is 2 to 3 years. The FDA just extended it an additional 12 months. So that is the process in which we refill the stations currently. The other thing you should know is that we determine the need for those boxes and the locations based on our partnership with DEA, HIDA, and the others in our area that provide the mapping systems for overdose events, whether it's fatal or non-fatal, so that we can determine where the need is in a specific area or demographic or community so that we can move those boxes accordingly. And that is the plan moving forward as we add a few to the layer going into this next year.
Yes, follow-up to that is, so you are taking notes and records on which boxes are getting the most action, so to speak, and being able to make adjustments accordingly, correct?
Yeah, so we are currently collecting that data and providing outcomes on a quarterly basis. And then we also communicate and collaborate with OCHN and OCHD, the health department, so that we can determine more need moving forward in different areas.
With the 200, I think it's 240, 250 people a year are dying in Oakland County with that.
Thereabouts.
When you look at the metrics, since you all mentioned it, is there like 100 boxes could reduce that 250 by 5, 10, 1? Do you have an idea of how more boxes will reduce the annual mortality rate?
Well, I think, you know, it's hard to get a full grasp on, because you don't know how many lives have been saved that don't make it into the actual recorded statistics, number one. Number two, they never make it into the death statistics, thankfully. So since we've been using Narcan in our cars, and all other police departments in Oakland County have joined us, how many don't make it to that number? It's hard to quantify what you prevented, but I can tell you it's saving lives. I mean, we've saved, just in the sheriff's office, hundreds and hundreds of lives. And you also were at our press conference when, with our same partners, we're the only agency in America using OPVI, which is the only FDA-approved opioid antagonist for synthetic fentanyl. So, you know, we're using whatever tools we can, Narcan, OPVI, wider distribution, education, you know, the rides that we talked about. It affects everybody, and we're trying to get everybody involved. We're speaking at schools, you know, you name it. And I've said this before, my daughter played soccer, and 3 of the girls she played soccer with are dead. And most of those girls got into it through a sports injury.
Well, the Attorney General talked about a post-pregnancy related
Yeah, there's
injury that she became addicted
pregnancy,
briefly, yeah.
different surgical procedures, sports injuries, self-medication for mental health challenges. I mean, pretty much you name it, and it ends up a lot in the same funnel.
But, and any of you can speak to this, what about the stigma that appears to be still pretty significant for people to say, hey, I have a problem, you know, and I need help? Because it's not, this is not an economically related addiction, it's at all levels of society.
Yeah.
Just can you all speak to the stigma, or any of you speak to
Well,
the
I mean,
stigma?
there's always been a stigma about seeking help or admitting that you have a challenge, and I think we're collectively trying to dispel that. It's not a weakness to ask for help, it shows strength. And whether it's a mental health challenge or an addiction challenge, to say I need help shows incredible courage. And so we're trying to put that stigma away. And I think that comes with education, it comes with broad coalitions like you see here. And, you know, especially from law enforcement point of view, the more we extend that helping hand and less the punishing hand, which we've tried very much to do in our programs, I think that also helps to diminish that fear factor.
Are you, when you say helping hand, you're also including things like drug court, right?
With the drug courts, the rides to recovery rather than to the jail, you know, giving out Narcan, having a crisis response unit that is following up with people and seeing how they're doing and saving lives. You know, I mean, all of those collective efforts are basically saying this is something we're all working on together. You're not alone, and we're not blaming you or stigmatizing.
Yeah, sure. Stigma. So I'd love to share about stigma really quickly because I personally have a diagnosed substance use and mental health disorder. And I think one of the ways we combat that is giving people that are struggling in whatever area of their life the courage to know that there are people out there that have too had the same issues, that have found successful results by being able to speak their truth and connect with the resources that are available in their community. It's important for us as an organization at the Alliance to hire people with lived experience so that they can kind of hold up that hope for people that are afraid to say, I'm struggling and I need that help. And that's a big part of the OE part of the OEND. It's the educating people to understand that there is no shame in asking for help. We cannot do this alone, and we need a collective group to come alongside of us and walk through some of these layers of stigma and suffering that exist.
And to kind of your point, I wanna be clear, we're kinder, gentler to the people struggling with addiction, but not the people profiting off of their deaths. So if you're a trafficker of fentanyl and other destroying of lives and killing people, opioids, we're coming for you. And we'll hold you accountable.
And that you guys have a tip line if people want to report so and
Yes.
so, that's like Crime Stoppers, right?
Yes, and we have a very effective regional consortium narcotics enforcement team that does a great job tracking down the people that are peddling this death in our community.
Is this something everybody should have in their home? Has it got to that point? Because we're not just talking about people that are using drugs illegally. I mean, your daughter's teammates, for example, or even elderly people. That they might forget if they take their Percocet or something.
I mean, it's something that I don't know if I'd recommend to every household, but if you've got someone that, you know, is potentially in that bracket that may be going through challenges in life, or maybe you've got grandkids coming over, there's no harm. Super easy to keep, super easy to learn. You know, I wouldn't necessarily go so far as like my mom living alone when she was still alive, and I basically her only visitor. I don't think one of the two of us are gonna need it, but because I was actually giving her a med. So it's, you know, each house makes a decision about whether that would be an addition, but it's one of those things where it's no harm, no foul. You know, it's not gonna be a problem. If someone gets their hands on it, it's not gonna cause a problem like other potential things might do that you put in your house, right?
April is Clean Out Your Medicine Cabinet Month. What's the ratio of the drop boxes that I saw one in Orchard Lake the other day where you can drop off your prescription meds? What's the
That's
ratio?
the Operation Medicine Cabinet program I spoke about.
Yes. What's the ratio of those boxes to these boxes? Are they one-on-one or do you think?
No, they're not one-on-one. I think we're in the 30s or 40s for medicine cabinet. We started that, maybe he's not here, I think back in 2006 or so, a long time ago. And that's, you know, try to make it accessible. It's a little different security question, obviously. You don't wanna have a lot of very potent opioids that are non-observed and are 24/7 access, because potentially you could have those broken into and removed. These, there's not a concern about that, you know, out unobserved or unsecured within. So the medicine cabinets are usually within a police station where they're observed.
And I know you've done this in the past. Are you planning one of those like Saturdays? You can just bring it in. There's gonna be deputies there to take this medicine.
Well, again, the medicine cabinet does it year round.
Right.
So in conjunction with DA, there's usually drug drop-off day and things. We've got one coming up in conjunction with them on Earth Day that we're gonna do a drive-through where you can just drop them off to us. So we do those periodically, but the unique thing again about Oakland County is that you can do it pretty much any day of the week. If your local police department or sheriff's substation has the lobby open, you can just go there and drop it off, no questions asked.
Any other questions? I don't wanna hog all this.
Yes.
Can you speak to, just to let them know that if somebody wasn't particularly overdosing, but you thought they might be, that it's still safe to give it to them, and we would rather them try it, because a lot of people are unaware, they're afraid to do it, so that's what I do in a lot of my teachings.
Yeah, so as Sheriff Bouchard spoke to and Denise asked the question, naloxone has a lot of data behind it. There's 10 years worth of data. It's safe for pets, children, all the way down to infancy. Very safe and effective. And I also just want to circle back really quick on the metrics. The individuals that are accessing these boxes currently are not necessarily people that are struggling with substance use disorder. It is primarily the friends, the family, and the people who watch the devastation of addiction in their life accessing these medications so that they can jump into action and save a life based on the training that all of our partners, including our coalition partners, provide our community. So we do want more people to understand that accessibility to that medication is that determining factor on keeping people alive so that they can't help themselves with this.
I just have one more question. You know me,
Why am I
I'm gonna
not
ask you a
surprised?
million questions, what a shock. You talked about mapping overdoses, so you could place those boxes in a good place. Is that ever used in preventative measures? Like we need 3 boxes over here versus 1 over there. We're gonna put extra education where the 3 boxes are in that community. You know, are you doing things like that?
Yeah, I
doing
mean,
corrective?
obviously, our resources, I mean, that's, you know, we use metrics all the time in police work, and obviously, our crisis response unit is focused in an area that has the large amount of activity compared to some of the other substations. So we always try to put resources where they're best utilized or most necessary.
And how much does all this cost?
That would be to the money folks.
Here alone, it's $1 million. It's around $1 million to do all the resources and things that we do. OV is a little more expensive than Narcan, so we look at how do we best get that across the community. And we're doing it in a way that it's a slow start, and we would love to do more, but with the opiate settlement and things of that nature, we'll have the funding, additional funding to put more resources out there. So the exact numbers and breakdowns, we can definitely get you that information, but it costs to keep people safe. The resources alone, just the hard materials alone, you can't even imagine the amount of resources it takes in terms of people and staffing and training and community education. And I do wanna go back just a quick second on the other question you asked about how do you know where to put a box or where to put the resources. Every year, Oakland Community Health Network does an annual needs assessment, and we talk to the people we serve, but we also look at data that tells us where else do we need to be in serving individuals with mental health disorders, people who need support with intellectual or developmental disability, who we don't associate with addiction, right? And as well as individuals who are struggling with addiction and those family members that are helping individuals. So that funding goes a long way in terms of just across the board, education and prevention is key. And even when we talk about peer supports or recovery supports individuals, making sure that they're compensated for the level of support and care that they give, because we can do a lot of things, but a lot of things do require those financial resources. And that's why when Sheriff Bouchard first spoke, he talked about how we all come together. So OCHN plays a huge role, but so does the Alliance, and so does the Sheriff's Office play a huge role in how do we allocate those resources and put them where they're most needed. And I think that's the critical takeaway when you ask those kind of questions. So a bulk of our funding, I would say 94% of our funding that we get goes out to the community for programs and services such as these.
Sheriff, can we ask about the home invasion?
Yeah, anybody else have anything on this?
Good luck with that.
We're out.
So they're back, right? I mean, where are they hitting and are they hitting in a different fashion?
I thought that was.
Yeah, it doesn't appear to be a different fashion, they are in fact back. We're still obviously working with our partners and analyzing it. We think there was at least 3 to 4 incursions of the groups in Oakland County in the last 4 to 5 days. There was one where they either were getting ready to go or it was pre-op surveillance where the same kind of behavior was observed, the same kind of movement. Teams of typically 3 or 4 homes that have been typically vacant, people are out of town or very, very high-end homes spread across Oakland County. Again, it's, people ask, well, what community or what neighborhood? It's not community or neighborhood specific, it is target home specific. Very high-end homes with probably high worth valuables in those homes that back up to an obscure golf course, wooded area, pond, whatever gives them access to come in unobserved, typically 3 to 4 people in the most recent rash and the ones that we had before. I think they have been gone for a period of time because, you know, we did level charges against a bunch of them. And we created the Southeast Michigan Task Force with all of our state, local, and federal partners. And that, I think, for the short time, put too much heat on them. And I know, talking to my partners around the country, Phoenix was getting hammered. Other cities around the country were getting hammered, but now I think unfortunately they've cycled back.
So you think that they're essentially just nomadic, they're going where the
100%.
pickings are easy?
100%. Well, they're going, they hit an area real hard and then they move on. And then they do that in a cycle and they share information with other teams. You know, they're trained elsewhere. You know, I believe the teams that we caught were trained in Chile. And they come here prepared, you know, I mean, it's very methodical. You've seen the videos we provided. They come in teams with backpacks. Each backpack has a different tool set. Some are the breaching tools, some are the electronics, the GM alarm systems. Very quick, sophisticated actions.
What are we seeing in terms of loss over the last, these 3 or 4 that happened this week?
Because these are so recent, we don't have total numbers on that. You know, I know for a fact that 1 or 2 of the homes, people still aren't back in town, so they haven't been able to assess what's missing. So we don't have those numbers yet, but I can say when we were getting hammered, it probably approached $1 million a week out of Oakland County.
And where are the ones that you arrested? Or have they been deported or are they still here?
They're in the criminal process.
And so are we looking at a situation where people need to be paying closer attention? In other words, if you have a high-end home,
Yes.
you said you're backing up to a golf course, to the woods and so forth. What do you do to prevent this?
Yeah, that's why I as soon as I started to see that we were getting hit again, that's why I posted it last night, when I got a call on one of these burglaries. Because I want people to, you know, we tend to let our guard down at certain points. You gotta up your game. A lot of these homes that have been hit, the alarm was off. If you have an alarm, use it. Try to get your devices hardwired. Try to have redundancy of communication so that you have a hardwired phone, you have an internet phone, you have a cellular phone, you have a radio backup. Because again, you don't know what's gonna be jammed with their jamming system, but we know a hard line most likely won't. But at least it gives you chances to get that signal out. Use the alarm, hardwire devices, so wireless motion detectors can be jammed. Hardwired back to your system can't. So do those things. Be situationally aware. You know, watch yourself, watch your home, watch your neighborhood. If you see something that's unusual, don't be afraid to call us or your local police if it's someone else. We'd rather check out 1,000 nothings and miss the real deal. They are doing a lot of pre-op surveillance, so at some time or another, they're there before they hit. So if you see something, say something.
And is that calling 911? Even if you're like, I think there's a weird van that's been loitering around my neighbor's house the last 3 days and it doesn't look like painters. You know, do you want people calling 911 over something like that, or do you want a non-emergency
Well,
line?
I mean, yeah, we have non-emergency numbers if, you know, but whatever is at your fingertips. If you see something that concerns you for your safety or your home, yeah, call us by either number.
Can you name the towns that were hit?
There are multiple communities. I'm not sure that they're ready to individually release it yet, but it was multiple communities across Oakland County.
Do you think they're coming from Chile again or a different country?
We don't know because we haven't caught any out of this group yet, but the MO is super similar.
What other cities besides Phoenix, can you remember?
I know LA was getting hit. I know there were some cities in New York. I can get you a list. Indiana. I think there were some in Tennessee. I can talk to
Ohio was that?
Ohio. Yeah, I mean, they're all across the country. Early on, when we started to get deeper into this, the intelligence estimate was at least 100 teams of 4 or more were operating just from Chile across the country. So now we know we have teams from Colombia, And New York intelligence has teams, like criminal gangs from Venezuela now. So we don't know how big the picture is, but we know it's startling.
Sheriff, do you think they're back in Oakland County because the weather's getting nicer out?
No, I don't think so. I think the heat was on for a bit and they cycled elsewhere when it wasn't quite as omnipresent. But I mean, if you think about it, a lot of the reason to be in Oakland County is during the winter. You've got a lot of snowbirds, very high-end homes, and that's when a lot of the homes were hit. There were nobody there.
Do we have any indication of how many of these 3-4-man crews are working in Oakland County?
We don't, because A, they don't talk, even when you catch them, and B, they're cycling. And so it's hard to put a real number on that, you just don't.
Do we know, like, do they operate, do they go to a hotel, do they rent a house? I mean, where do they operate at?
They've done all the above. They've done hotels, they've done houses, Airbnbs, they've done, because of COVID, apartment complexes switched to a lot of online. So they've rented apartments, they have multiple identities, so if an identity gets burned or used, they get rid of it and use another one. They've actually been caught in some states that don't have any kind of, no bail or bond kind of thing. And they get caught, they give the one name, they get out, they dump that, and then they go back at it with a different name in a different state.
Thanks.
So you expect, there's another week of folks going on spring break, maybe 2 weeks. I think there's this whole cycle going on. So you expect more of these to happen then because nobody's been caught yet for this cycle.
I just think it's an ongoing problem, not necessarily related to spring break or winter. I think when their rotation gets back, they're coming here because there's assets here. They were taking a lot of money out of very high-end homes. And a lot of our victims are names everybody in this room would know.
Are the sheriff's office and the local police officers, are they doing more neighborhood patrols, stepping that up because of this?
Yeah, of course. So, you know, as soon as I got word, last night, we put out to all of our patrol cars to go look in some of these neighborhoods to, excuse me, do the kinds of proactive, you know, kind of driving and looking for anything that may be associated with that. And I'm sure all of our partner agencies did. I got a call from a partner agency last night that kind of spurred this on. Yes.
Sheriff, a lot of times people will put on Facebook or Instagram, they're on some exotic vacation somewhere. Is there any indication that these teams are that sophisticated that they're going through social media accounts to find out if somebody's home or not?
Yeah, it doesn't specifically look like they're using Facebook to identify their targets because it may not be associated with a house. Typically, they seem to focus on a house and a person that they have done research on more so than Facebook, but it's not something I would ever do. I would strongly encourage people not post, I'm going on vacation, my house will be empty, please join it. You know, if you wanna post pictures of your great vacation, I suggest when you get back, say I'm home, but I had an amazing vacation, here's my picture. I'm at the airport, be gone for 2 weeks. You know, it's just not a good idea. And the other thing, a good safety reminder, check your devices, check your phones. There's geospatial tags that go on pictures that you take on your phone. And if you know what you're doing and you don't have those tags turned off, you can determine where that picture was taken and at what time. One of the guys, I think from Mythbusters, I think took a picture, a selfie, leaving for work. And he had the geo information on that picture and someone able to determine exactly what time he leaves for work and where his house was from that picture he posted. So, you know, everything you put out on the internet, it's not just your family and friends looking at it. I caution that on so many levels, not just home safety, personal safety, child safety. You know, what your kids talk about, who they share information with. If they ask them personal questions about them or their family, they shouldn't share any of that. Anybody that needs to know that knows it.
Do you have any video of these recent ones?
Actually, some of the folks are out of town and we're trying to get access into some of the video. So we don't have much at this point, but I wanted to, you know, unfortunately say they're back. Because, you know, the community needs to be aware.
It's not just the homes that were targeted, but the neighbors may have those doorbell videos that you're doing, I presume you're doing all that
The
anyhow,
investigators
yeah.
always do a canvas and
Yeah.
see what kind of recording devices are around. There's a host of things that they're doing, but I think the question was specifically we've had very good video of some of the homes that have been hit. So obviously that'll be part of the current investigations to try to access the video cameras if they had it, and do they have usable video?
Do we know specifically about these guys, how they case? In other words, like, do they go out at night looking for the houses that are dark, and that kind of thing?
Yeah, they do it in a variety of ways, you know, in communicating with our partners across the country, we've seen them where they've used trail cams with battery operated cameras that they have in a camouflage setting, and it records comings and goings. They've used trackers on cars to determine when you're coming and going. They do pre-op surveillance in different ways and different modalities. And you know, we have pretty good information that there's been drones utilized.
Trackers on your car, so what would you look for if you're in I wouldn't worry about it because of my car in my neighborhood, but somebody in a nicer neighborhood, what should they be looking for? If, you know,
Well, I
is it like an air
I
tag?
doubt you're gonna be crawling under your
Right.
Mercedes, but you know, anything that's foreign that's attached to your vehicle would be something that, you know, would raise questions, but it's just something to be aware of.
It's not like you can use your iPhone and scan your car and see if there's a device there that isn't yours.
No, because it depends on the modality of the tracker, whether it's transmitting or not.
Okay, fair enough.
Thank you, Sharon.
Thank you.
There's a whole package. Like,